if you'll indulge me, since I haven't attended quite a few events, I'll just take a couple of minutes to say that, certainly we started with the notion that the lifeblood of any movement is ideas, and that the Dravidian movement, which had already lasted more than 100 years since the founding of the South Indian Liberal Federation in 1916, for it to continue to have this run, we needed to refocus on ideas, on values, on principles. And we did that in many ways as part of the DMK, the current descendant of the Dravidian movement. But one of those initiatives was the Dravidian Professionals Forum. And in that context, though I personally, after multiple attempts, was not able to bring the kind of traction that I would have liked and really ought to by responsibility, I'm very grateful that people like Kuhal Gandhi, like Dharanidharan, like Dr. Arvindan, like the many committee members have taken this up and have done so many wonderful events on so many hugely timely and relevant topics. And so I take this opportunity to first thank them for bringing this vision closer to reality and for all of the efforts they've taken so far. For today, I'm very thrilled. I'm very happy to participate. And though I have these values in my heart, in my politics, and though, as I said to the few department IAS officers and other officials that the Chief Minister has given me as a minister, I have 4 portfolios. To all of them, I said the same thing. I said, though I'm a bit of an unusual politician in some ways, in some other ways, I'm the most kind of mercenary politician you've ever met. Every single time I open my mouth, every single time I take the cap off my pen to sign a paper, a bill, a file, I say, does this tie back to the values for which I came to public service? Does this adhere to the principles that the Dravidian movement has kind of fought for and stood for? And so I am every day trying to live the values and implement actions based on the principles that brought me in. So in that sense, I couldn't be a more ardent supporter of states' rights, of federalism, of the notion of local self-governance in every way, not just union to states, but all the way down to local bodies and down to as close to the people as possible. Because after all, self-determination is only a small extension of self-respect. And so it is a core value for us in the Dravidian movement is local self-governance, and that can escalate all the way from panchayats and district boards all the way to states. But what I should rather talk about today, since there are many people who can talk more about the values, the philosophy, even the rationality behind it, I want to just talk about the limitations of the nationalistic model that we are seeing in our lives every day as administrators. And I think perhaps the greatest example of that is the way this pandemic has been handled. The fact is that there is almost no policy that can be implemented at the national level that is constructive to managing the pandemic spread on a day-to-day basis, with the possible exception of, procurement of that to a limited spectrum of things like oligopoly products like vaccines or certain types of medication that cannot be had for love or money in adequate amounts in the global market. So if you take those out, then clearly those require a monopoly procurement model, a monopsony, and only the union government or the national government is able to do that. But in every other way, this is the classic case where the values of self-determination, of local self-governance, of devolution of power have been kind of indubitably established. So if you take the Tamil Nadu situation alone, we'll come to the nation in a minute, but if you take the Tamil Nadu situation alone, between May 2nd when the results were counted, May 7th when we were sworn in, And today, you can see great disparity between districts. Every district took a slightly different approach. That's the way the chief minister sent us. He says, it's very difficult for us to control this from Chennai, like the old government had been doing. And so wherever there was high rate of spread and high infection and high positivity rates, he designated ministers and he said, you're going to take care of this. And you can see the wide range of outcomes in almost any measure, the time to suppress the peak, the positivity rate trend, total positivity rate trend, the fatality rate trend. Almost any measure you take, you can see wide differences between districts, all run under the same state with the same party in office, but different ministers and different officers doing the work in different districts. And of course, we want to replicate the best practices. Of course, we want to share our learnings. Of course, we want to do what's right for everybody. But the closer you get the decision-making power to the people, the closer you get the feedback, or the tighter you make the feedback loop between action, outcome, learning, correction, reaction, then you get the kind of outcomes that we have seen. I'll just give you one example. In Madurai, for example, in Madurai district, we went from a peak load of about 1,500 cases a day and a positivity rate well north of 20%, down to yesterday was 100 and something and a positivity rate, I think around 2%, hovering around 2% in less than 3 or 4 weeks. In fact, in less than 2 weeks, we took it down by from 1,500 to below 500. And this is quite unique. Nowhere else in Tamil Nadu have we seen this rapid turnaround. But the greatest reason for that was that we distributed the work, not just within the corporation, but we said we have to make sure that the rural spread, doesn't happen and doesn't, conflate with the urban issues. So we stopped people coming into the city where the primary health treatment centers were. We located 10-bed hospitals in every panchayat. We hired additional staff, doctors, nurses, and put them out there. We sent medical supplies. We started vaccination in 75 different locations. We made sure that, we got the local women's self-help groups involved. We got them to go door to door and find out people who had symptoms and proactively bring them to the panchayat treatment center and get them treated early before they got so badly off that they needed secondary, tertiary care and had to come to the GH in the heart of the city. So we're just finishing up a case study, which we'll probably publish internally to the government first to see. There are still a few districts where this is not true. But this is the living, breathing example of federalism all the way down to every village, every town, every district union, every ondriyam inside Madurai district. And in Madurai Corporation, breaking it into mandalams, into wards, into red wards, blue wards, green wards, etc. If this is what it takes to succeed in a state of 80 million people in Tamil Nadu, surely it is inconceivable that a one nation, one X of anything can succeed in a country of 1.4 billion people where the diversity is based on language, history, culture, diet, development, per capita income, access to education, social development indicators, any number of statistics you take. So I don't think there is any debate really left about what is the way of the future. I have said so at the GST Council. I think that if we do not figure out a way to devolve powers, starting with the power for direct taxation and indirect taxation closer to the people, as it is in China or in America, states and counties and cities levy taxes, sales taxes, income taxes, then I think we have a very dismal future ahead of us. And if we didn't believe that before COVID-19, we certainly understand that with great clarity now, because you can see all the places that the union tried to put a one-size-fits-all policy have really, really, really suffered. And for the first time, in fact, in the GST Council, I can say that even between the 43rd meeting of the Council and the 44th meeting of the Council, which was only about a week or 10 days apart, we could start to see some of the bigger BJP government states start to separate themselves and talk more about their citizens and their rights rather than their political party in common with the union government. So I think this discussion is particularly timely. I think as a nation, we are at a kind of interesting point. What I believe will turn out to be, in retrospect, a kind of transition point or an inflection point. I think the myth that worked for so many years, aided actively and abetted by the media, of this aura of invincibility for two human beings that supposedly could run a country of 1,400,000,000 people without any kind of fault or downside or outcome, negative outcome. I think that is being broken, or if it's not already broken. I think there was an article in The Wire by my friend Rajesh Jain, who runs this Prashnam survey on, he runs the survey system called Prashnam, and he had done a survey on deaths in the Hindi belt. And that was quoted in The Economist this week. And you can see that in the Hindi belt, about 40% of the people who answer the survey who had somebody who had a loss in the family have started pointing fingers at the union government and the prime minister. So I think the tide is starting to turn. Maybe I'm being overly optimistic, but it's not that worries me. It's how do we design the new model? I mean, what does the future hold? How do we get from here a broken model to a much better model that we need? We are not here to find fault. We're here to get good outcomes. So I'm sure this debate and the many wonderful speakers with their insights will add a lot of value to this. I wish I could have stayed, but I'm sure I can catch the recording of it at a later date. I apologize that I'd given some other commitments, so I have to leave. But thank you all once again for participating. Thank you for enlightening the debate and for adding your thoughts. And thank you to Dharani and Pugal and Dr. Arvindan and the other committee members and the staff who work on the DPF for continuing to hold the torch and increase the light. Thank you.